Well, greetings again. This is Dr. Bill Wyatt with the American Orthodox Society, and this is the 7th case I'm going to show where we did these cases by removing the lower 6-year molars, and you come to the back of this however much you want, depending on how much you want to bring the forward jaw, the upper jaw forward. I'm getting mixed up in this stuff. I'm 96 years old now, and it's beginning to show. And so, anyway, it's hard to keep your mind going when you get that old. But anyway, I needed to get this across. If this goes, many Class 3 cases can be treated by removing the lower 6-year molars. And however much you want the upper teeth to be brought forward, you can pin or put the screws behind your bicuspid back here and pull on that and make the upper jaw go out wherever far you want it. So watch this and do this, even though I wanted to get this across before I get too darn old to do this. But I have a lot of people out there say, don't give up, just keep going. So I am trying to do that. So let's get on this case. It's got a lot of slides on it, and it's a young lady, real nice gal, and she's Class 3. Not a terrible Class 3, but teeth are sticking out here kind of in front, down here on the bottom, and like that. The upper case, many of these are mouth breathers, and you see the lower jaws will be out further than the upper jaw. A lot of this mouth breathing stuff must have something to do with the Class 3s, but nearly every Class 3 I ever worked on, I could find somebody in the family, even if I had to jump over to the grandparents that had the problem, and genetically it crops out in the person. So let's get on down the line here now. I've got a lot of slides to show. Now, I'm going to have to bring this, we're going to take this out, and we'll bring this tooth up to a Class 1 relation. Now we can pull it, however much of this you want to bring forward, by where you pull this back, put your pin or a little screw in there and bond it to this tooth, and don't let this go back anymore. And you've got to pull this space forward here as well as pulling this forward, and you will correct the Class 3 problem. And so we'll watch it do that as we go through it. All right, here it is, and we have there's some problem here getting the cuspid lined up. Now we take the lower 6-year molars out, and here it is. The jaw is a little further out, and we're going to reduce this part. And here we go. Now that's going to bring this back to where this is fitting here, but we'll have this corrected by bringing these teeth forward by coming off with Class 3 elastics up here. So pull that out. We can tie this on here and bring it out too, and you can hold this where it is, pull these other teeth out to make that. Just make sure you've got the wisdom tooth before you pull out the 6-year molars now to do that. So here we've got a big old gap, and we're going to pull that tooth forward, and we'll pull this back a part of the way, and I didn't use the pins or anything, so we'll close this up and bring this forward too, up above. And this should work out doing surgery like that, which is doing the job of the surgeon. So the surgeons are not going to like me very much. If this were to take over, it would keep about a big portion of the surgical orthodontic cases could be done this way. And I'll stand on that even though I'm 96 years old. I can't believe I'm that old, but I've been around a long time. Now here's this gal's looking over there smiling. She's a neat gal to work on. I enjoyed visiting with her, and we've got the face looking real good at this point. We can continue going with this. I've got a lot of pictures here need to cover. So now, watch. We had these wisdom teeth. They have to get in. Now, when you pull this out from under this tooth is going to be hanging in the midair. So you have to put a retainer in and put a little block here that holds it from going down. And the retainer comes around behind here and has acrylic over this that won't let this tooth come down, what we call class 3 retention. I need to show that again. So this case right here, you don't just pull this up here and leave that hanging there. You have to stop it from coming down until the wisdom tooth erupts into the mouth. So you're taking a little gamble on the treatment of the case. Now, we pull this up and pull this. We're going to bring this forward. These are kind of out of shape here. We're bringing this 6 year more out. All right, here we come. We're bringing it forward. See, the roots are coming with it. Look at the space it leaves here. This is coming forward, and I've shown you this. You can put a arch wire and come in and do like this and run it down, or you can come over and make the little deal. This is more efficient this way, like that, to bring this forward, but the other one works also. So now we've got this tooth up here. This is leaning in quite a bit, so we have a lot more of this to this. This tooth will have to come up underneath that. All right, this is 6/19 of 90, and she's age 16 and 7 when we go ahead and finish this. Now the wisdom tooth is going to have to, you're going to have to sit with this thing in a retainer that will not let this tooth drop down. And I hope you learn how to do those. You make your retainer, you fix it where this tooth can't go down without pushing the retainer down, and the retainer holds this tooth up until this tooth comes in, and it'll drift up and fill that gap. I don't know how close we got before we finish this, but okay, there we're showing it first started off. We'll take that out, bring the lower teeth back underneath there. And so here we're tying this back. I'm going to run this real fast here. We're closing that up. Now we put a intruding arch here to bring this down a little bit and bring this forward. Now it's 89. Now at this point, we have the lower second molars up here that almost close the gap. And here it's 90. We just about finished it out. So in 12 of 90, we have finished this. The wisdom teeth haven't come up at this point. So we'll watch it until I can see that person who wears this retainer that holds the upper second molar where it is and allow that bottom one to come up underneath it. And you can see the bottom teeth coming up here. This is a few years after, this is 91, after we finish the case. So we've got a retainer in here that the acrylic doesn't let this come down, and we'll snap it in, and it won't let this retainer go down because it's holding onto this tooth, This tooth is in contact with the one below. So the retainer has to be worn while you wait for the wisdom tooth to come in and fill the gap. So we finish this back down to this point and got this in here, and we're waiting on this tooth to come up underneath it. There. So here we are, and she's got a nice little bit of a gummy smile there, but not all that much. But the vertical height is great, and the facial structure, and she's got to wear this retainer until that lower wisdom tooth comes up. And that's the end. I'm going to show that. But I hope you don't wear out looking at these cases. These are cases that normally would be surgical cases. And you can do it by taking out 6-year molars, bring this back where you want to, and you need to bring this further forward. Pin the lower teeth here. I didn't show any of the pin stuff on this, and we hadn't really got into that a lot, but you can do that and make the upper jaw come out so that it's similar to a double jaw surgery on that. Thank you for watching, and I hope you understand. I won't show any more of these cases, but I have had a lot of cases like that we have done the molars, and we did not have to do surgery. So the surgeons aren't too favorable to me here, because they're cutting out part of the work they do. But you can do virtually the same thing by doing that. So thank you for watching, and I hope this will help a lot of people that have this problem, that don't want to go to the surgery or can't afford the surgery. They can't afford this, and it's really, in my way of thinking, better if you can work it out completely this way than it is to do the surgery. So thanks for watching, and I hope this is studied by everybody that does research in here and find out this works, and it will work. And so do this, and we can reduce the amount of surgery that we have to do on these jaws. The insurance company should be interested in this too. Thanks again for watching, and I'm going to sign out.